Aloha everyone, I'm Susan Nutowitz with letsfeelexcellent.com or the YouTube channel by the same name. In this blog, I want to help people understand what happens when they herniate a disc, what happens before they feel the symptoms of herniation, what happens when a person doesn't feel any symptoms of herniation, and how to take care of it in any stage of the game. And I want to do this because I find that for the amount that it happens, it's so frequent. Back pain is so common that and a lot of people don't understand it. It's very misunderstood. So let's see if we can understand this a little bit. So not everyone feels spinal degeneration, tight muscles, or back pain. Although at least 80% of all people walking this earth have a herniated disc. And we say at least 80% because not everybody even gets an MRI. And so a lot of times if there's not these big pain episodes, these big life-stopping pain episodes, and quite a bit of that, then, these people aren't getting an MRI. So we say, the statistic is at least 80% of people are having herniated discs, but not everybody feels pain or stiffness. Although a lot of people do. Believe it or not, back pain is the most searched health concern out there. Almost everybody feels it. Even kids are feeling it, and kids are starting to feel it far more frequently these days. And so, I just want to address this because, a lot of times we think if we have a symptom in a certain area that it only means that that area has the problem. It doesn't have anything else to do with the rest of the body. And what I want to show you is that back pain has everything to do with the rest of the body. And when we feel pain, it is because our body is not supported. So the weight coming down our body is not being supported. Like this spine is degenerated, and we know that because of these bone spurs that are happening here. You see where my cursor is? These red areas. These are parts of the body that have grown so that it can be extra structure. Why? Because this spine has been moved and it's probably fixed in this way. So it's out of its most functional curvature. And basically, like I keep telling you, it boils down to the fluids of the lymphatic system can't get into all the structures that it needs to. So in this case of the spine, the fluids of the lymphatic system can't take out the trash, and the fluids of the blood can't bring in the nutrition. So the tissue becomes dehydrated. And many people that suffer from back pain know this. They know that the tissues are dehydrated. We're going to talk a little bit more about this, but what they have been told is that it is natural and normal. It's just a sign of aging, and that is not true. This structure doesn't become fixed at all, or it doesn't become fixed in this way because the person became a certain age or they have the certain genetics to do so. Genetics or outside injuries, outside situations can have a lot to do with it. But if I take a plumb line and drop it down the center of where this person's midline might be, sort of there, it needs to be a little bit off to the side here. But you can see that the top of the structure, because there's a rib cage up here, is going to be tilted in this direction. It's going to be tilted this way. And so the force of gravity is actually going to be coming down here, not through the midline. Right? So there's going to be gravity coming down here. It's going to weigh 33.5 pounds per square inch, plus the weight of the person's body. So the reason these bones grew is to give, just to kind of cantilever out here and give this person some support, right? Because the gravity's coming down here, it's not where it is here. And as it does this, then the little lava tubes of the lymphatic system and the circulatory system, the fluids cannot get into the small spaces. And so look at the space for this disc here. Not much. See how that would be squished? So what happens is it's no longer like a normal disc. This is a normal disc right here in green. It's circled in green. And then it starts to squish. And then this one is showing a bulge. And then this one shows an actual herniation where the toothpaste-like substance in the center, this toothpaste-like substance in the center of the disc, actually starts to come out of the disc. But what it did show is these bone spurs. You see how the bones start to have to conform to the disc, so they start to get funky. But what I want to tell you is the disc is so strong. We tend to use a jelly donut as a model or a marshmallow, and those are good models, because of showing you the support, the shock absorption that it does, that it actually squishes. See, like you see in here. But these discs are not like marshmallows. They're not like a jelly donut. This stuff inside is the consistency of like toothpaste. And this stuff here is so strong that in dissection, it's hard to even get a probe through it. And then there are these rings. I don't know if you can see them, these faint little rings. And the rings are like steel. And there's 8 of them. And see, I drew like if they cracked. See, like these ones cracked. The spinal compression would have to be the same way. For a long time, the forces from above and below would have to fix the spine in this manner where it would cause these cracks over time. And in order for this jelly, this toothpaste-like stuff to come out of the disc, all 8 of these have to crack in a line. It has to make a little river here. It can't be like, here's a crack here, and then here's a crack over here because, you helped Cousin Vinny with the furniture, and then this one was the time you were at that job that was so horrible. And no, it has to be the same, in the same line for this stuff to come out. But just because this thing doesn't have to herniate all the way and rupture actually for you to feel pain. People can feel pain just from the bone spurs or the dehydrated tissues themselves, like the disc itself can actually cause pain itself. And when the tissues are dried out or they're so chemically ridden, then they will send a signal up to the brain and say, we're going to have damage here. So we need to do some things. It will alert the brain. I find that people want to minimize it. They have these episodes that they remember because they are life-stopping. The pain is life-stopping. It's excruciating. And yet they will say to me, oh, I just pulled a muscle. Well, did you pull the muscle, or did you pull the tight band within the muscle, or the wrappings around the muscle? Did that get tight and dried out? Or was it a dried out structure that was getting frayed to the point, or damaging to the point, or getting torn to the point where it just said, hey, we need you to stop and not move? There are structures in the body that will do that, like the quadratus lumborum. And this is famous in the back pain arena because that's its job, is to stabilize the spine and the hips. And so when the discs in particular, or it could be the ligaments or any of the soft tissue around the structure in the spine, when it gets to that point where it's going to become damaged, then see what will happen is the QL will get short. You see like this, where this green arrow is pointing? The QL will get short. See, this is a stretched QL because it's leaning. Does that look like the first picture we saw? Okay, so what will happen is the QL will actually spasm, which means it'll be contracting on its own. And the reason it's doing that is it's saying to the person, don't move, because things here are going to break. I want this person to stop moving so we can get the immune system in here and we can start some inflammatory processes and get some prostaglandins going and clean this stuff up, and then lay down some collagen or whatever we need to do to make it stronger. But there's a problem with this. If you leave it to this point and say, okay, well, I'm just going to have a little vacation every once in a while and just have it for however long it is, a couple days, a week, 2 weeks. Some people are laid up and in bed. There's a few different problems with this. For one thing, it's only going to fix you up to get you up and running. It's not going to get you to the point where the problem is rectified. So the forces from above and below that are compressing the thing, whatever's causing this fluidity not to happen, and the structures to degenerate, is still going to be going on. So this is just going to get you to where you're up and going because you're going to want that, and so the body's going to serve you. So that's not a good way to do it. And also, how are you going to be? There's not like one position that's the resting position that's perfect for the spine. We're dynamic. We're made to move. And so we're made to, you would have to actually just be responding and trying to figure out what way the spine wants you to move or be still or not to move, the way the whole body wants to be able to get the fluid to where it needs to go. So when this kind of thing happens, when the body takes over like this, we call it a hot injury. And it can happen for a number of reasons. But just to give you a little idea of the pressures coming from above or below. Now, see, this woman, her posture looks fine. I mean, she's lifted. She's not slouching in any way and stuff. And yet, she has some things to work on. Now, she's in a healthcare practitioner's office because she's getting a postural assessment here. And I've drawn some things where the spine could be in little rotations and they could be fixed. Now, what I don't know about her from just a picture is I don't know her state. I don't know the way she balances that state. I don't know her genetics. I don't know if she is using in her movements more of her extrinsic muscles and not using her core, which is really, really common. But I do see why, she might have some compression. See, here's a rotate or a curve, a bend here. And so we can see a little bit of um, something that might need taking care of. But I would actually address the whole person, to find out how I could serve her. And I see her feet are really wide apart to support her pelvis. And so when the center of gravity comes through, she has very little to support her in her midline down here. So these muscles are going to have to contract to give her support towards the midline here. And that could compromise her spine there. But in any case, she could have a lot of reasons why she might have back pain or any kind of joint pain herself. So there are common myths and half-truths about back pain that I want to cover. A lot of people have this experience, this episode, where they're doing something and they lean over and they pick something up and they have this back pain experience, those where they can't get up, or it seems like everything's frozen inside, and there's pain after it. And that could be a lot of different reasons, both emotionally and physically, for that. Although I find that, because we can't see it and because we don't, usually understand it, one of the myths or half-truths are, when the pain is gone, I don't have a problem. And like we discussed, some people don't even feel pain. When you have the pain, you have so much of a problem that you're having damage to the point where your body really wants you to know about it. So, yeah, you could have pain, but that's a hot injury. It's very limited what we can do for the actual problem, because taking care of the hot injury doesn't correct the problem. It doesn't correct the structure. It doesn't make the structure more functional for the person so that the energy can flow through it, the gravity can flow through it. So what we want to do is, especially when there is no pain, or preferably, downstream of the problem, before the problem happens, is rebuild or restore the tissue or keep the tissue in optimal condition and the structure most functional for that person, so that we don't have a problem. And when we do have a hot injury, we want our immune system and our inflammatory process to be in optimal condition as well. So we want to help that inflammatory process. We don't want, we don't want any kind of pressing on inflamed areas. We want to use things that can help the inflammatory process, just so that a hot injury can recover faster, because we don't want to be in pain and we don't want to have damage. So we want to incorporate things like lymphatic drainage therapy to bump up the immune system and specifically help that area to get more prostaglandins in there to clean up the area. And hydrotherapy like ice can help. The heat, people ask me, is heat good? Heat is more for sore muscles, and ice is to reduce the inflammation in a good way. I'll talk about unproductive ways to so-called reduce inflammation or stop inflammation. Also, craniosacral therapy, a specific craniosacral therapy, can really help to calm down the nervous system and allow that immune system to take over and do what it needs to do. Sorry, just getting a little drink of water there. Okay, and we can also do all of those things for the inflammatory process and the immune process in the chronic state as well. Uh, that's when you have more of like the dull aches, or it's not like the life stopping pain. That pain is saying don't move. The tissue could be damaged, or it's in the risk of breaking more. So we definitely want to heed that. That's an important message. It is. So number 2 is, well, I already have damaged tissue and there's nothing anybody can do about it, so I might as well. I'm going to hell in a handbasket here. No, I think everything can be restored, and definitely in my own case, I've had pain to the point where it was every day. It was very systemic, and I was able to turn it around with my 5 pinnacle system. That is why I created that. But I was able to turn it around with that, and I know that, people don't have to be suffering in pain, or at least it can be very minimized. I haven't really seen any case where it's absolutely impossible. There's so much help out there. Sometimes, there's a rip in the tissue, and I need some help from a different practitioner, and so I will refer my clients out. But we can figure all this stuff out, and nobody has to be suffering with these pains. Okay, number 3 is I did this when, for example, I was helping Vinny move the furniture. We started to talk on that. Okay, no, the tissue took time to wear down. The tissue was fixed in a way. The structure was fixed in a way for a long time, or this dehydration happened for a long time. And it doesn't just happen because you're unlucky. It does not happen because you're unlucky or you have such poor genetics that the situation happens. I mean, you could have a compromised structure. Sure, you could have situations that you're disadvantaged to, but nobody is disadvantaged to the point where it's just useless. There's nothing that can be done for them. Okay, number 4 is very important. I have inflammation, so I should take an NSAID. Now, an NSAID is an anti-inflammatory, like an aspirin or an Advil or a Motrin, ibuprofen, these kinds of things. These are NSAIDs. They're chemicals. They're really strong chemicals, and I would highly avoid them for all things at all cost. Yeah, they do give you temporary relief of the pain. They say they reduce the fever, they reduce the inflammation. Actually, what they do is they stop the inflammation. They stop the prostaglandins from doing what they need to do. So now you have more of a problem. You have more toxic buildup in the area, and you have more chance of degeneration to happen. So they don't take care of the problem in any way, and they just add more to the problem. Plus, they're highly toxic. Did you ever wonder, when you take one of these things, how it knows to go to your back or wherever you want it to go? Well, it doesn't. So it goes to everywhere. It goes to your organs, like there's prostaglandins that you need in your stomach lining, for example, and it wipes all those out too. So, okay, you temporarily relieve this pain that's happening in your back or your headache or whatever you took it for, but then you can't digest anything because now you have a compromised stomach linings. Your kidneys have a hard time filtering, and as we know, when the kidneys go down, everything starts to go down. The kidneys need to filter so that you can have the hormones that you need. You can have the minerals that you need. You could take calcium all day long. If your kidneys aren't working, then you're not going to metabolize that calcium. And you're really not going to metabolize calcium or anything else if your GI tract is bleeding. Yeah. So NSAIDs cause this. They cause your organs to break down. Even your brain that's an organ, can't really function with the continued use of NSAID. So it's not something that we really want to take all the time. Number 5, pain and stiffness and degeneration is a natural sign of aging. Okay. Some of this dehydration is happening, but you see this here? This spine that's fixed this way? This is not a natural sign of aging. This didn't happen because the person got old. This is how this person moved, how they thought, what they ate, what they breathed. All kinds of factors like this cause this to happen. And this person doesn't have to have this happening. Now, one thing we know is that, or rather that we don't know, is that we've never seen a group of people raised in optimal conditions. We've never seen a group of people, different kinds of people in different genetic constitutions with optimal state management, that are getting optimal rest every day, that move in a way that's totally functional for them, and have pretty good spinal alignment or joint alignment, that eat an optimal diet and have their hormones balanced. You know, we haven't seen a group of people like this. So maybe spinal and joint degeneration don't even have to happen. But what I do see and what I do know is that it's happening more so. Our genes are becoming more weak, and so it's happening at an earlier age, and we are aging way too fast. So more and more of these problems are going to happen. So there are some exceptions where people have very strong gene constitution, and they have mastered at least 3 of the 5 pinnacles that I talk about. At least 5, or at least 3 of those 5 pinnacles. And so we're seeing a turnaround with that too. More and more people are interested, and I love to see the young people especially interested. I love to see any person of any age interested in it. But we're seeing more and more people that are interested in health, in living in optimal conditions. Not only for selfish reasons, they realize there's more of them to give. And so it's very much worth it for them. Number 6, I exercise so I will never have a problem. Exercise is great. That is true. But it is rare. Rare's the person that lives a low stress life, eats an easy to digest diet, balance and moves in the way where energy runs throughout the body, and it totally serves them. So, exercise can cause repetitive strain. Exercise can cause, even yoga can cause the joints to compress. If you're using the same movements all the time and you're not getting leverage on those joints, and those tissues are not free to move, all of them are not free to move in the total range of motion, then it can cause this gluey, sticky, connective tissue to start to form, and this degeneration to happen. Now here's a person with lower doses, excessive lower doses. And what I want to show you here is even this person, just with posture, has forces coming this way. So the forces are going to pull this spine into a position, and you can easily see how the disc can become compressed. just from this curvature. Now, this is not really a bloated gut, but so many of us have that. And so if this gut was having a little bit of dysbiosis, then that would also be pulling things forward. And again, I see even kids like these days with the bloated gut, the dysbiosis. It happens, and so not only is there a whole lot of compression here, but above, this spine is going to have to curve like this in the thorax, and this can't be supported. This is not optimally supported. I know this was my postural pattern, and I couldn't undo it myself. I had to go to a structural integrator. I had to learn about the body as well, but mostly I had to get a structural integrator in here to free up these tissues and actually move the structure so that my spine could relax in a more easy position. And so this is only one example of how posture can really affect the spinal compression. And so many times, people say, well, so what? I mean, I have a gut. I'm not really concerned about being a skinny mini. Or, so what? My spine curvatures don't really bother me. I just want a massage every once in a while. Well, what I want to tell you is if you're constantly creating inflammation in your body, then what happens is over time, the inflammation is just automatic. And then we start to have autoimmune diseases and things that are labeled as such, like arthritis or fibromyalgia or chronic fatigue or different kinds of labelings, because the energy cannot move through our body and the fluids cannot flow with our body. So it's really not a good idea to have this happen. Also, remember, the acid just backs right up into the connective tissue, into the joints, and that's why people will start to say, well, yeah, I have back pain, and then I had knee pain, and then I had this elbow pain, and then I have headaches, and then I have digestive disorders, and they start to stack all of these complaints up. That's when definitely, then you have systemic issues probably from acid buildup. I'd have to look at the details of one person, every individual case, but that's usually how it is. So what are we going to do about this? Okay, it all boils down to this. So if you have ever felt pain in your life, a life-stopping pain, and especially the situation that I just described, where it might be in different spots at different times, then you probably have tissues that are dehydrated or degenerated. Very, very high probability. Get it checked out. So at the very least, there could be more of you available for others and for life in general. Go to your structural integrator, get it assessed, or you can book an appointment with me over Skype, and I can assess you. I can take a look at all of your criteria and give you some ideas of what you might do in your life to increase your life so you can have a life that does feel excellent. But you can definitely go to a structural integrator or someone that works with the entire body. Because, like I said, just because you feel pain in the low back, it doesn't mean that you have only pain here. It doesn't mean that you just have pain here. Whoops, that's not a good color for that. It means that this took a while to have happen. Okay. And like I was talking, consider each of the pinnacles of the five pinnacle star to see how you can make your life more optimal and prevent things like this happening. Again, if you are in pain right now, you have a life stopping pain right now, that is a hot injury. You don't want to take NSAIDs for it. You want to do stuff that helps to heal that. It helps the immune system, it helps the inflammatory process. So, you want to open up the lymphatic system. So, maybe invest in a lymphatic drainage therapy, one that can be specifically delivered, or use some hydrotherapy at the very least, some ice, um, and maybe some craniosacral therapy to help the nerves out. Then, after that hot injury is cooled and you have a chronic situation, then you can start relieving the pressure from above and below and get and from the sides, from the rotations too, and get the whole situation worked out. I hope this video was helpful to you. If it was, please give me a thumbs up and share it with anybody that you would think would be interested in this, particularly people that do have back pain. There's an awful lot of you out there. Let me know your questions at letsfeelexcellent.com. If you're interested in any appointments, it's appointments at letsfeelexcellent.com. And, I hope this really helps to shed some light on this issue. I'm Susan Nudowitz, wishing you an excellent day. Aloha.